During Alzheimer's disease, person is losing memory gradually. That's why it's very difficult disease. Eventually person can't recognize even family members, and also there is changes in thinking and behavioral difficulties. Alzheimer's disease is not difficult only for patient but also his or her family members. If we want to imagine Alzheimer's disease as an analogy, we can imagine library where books are lost and destroyed gradually, and eventually we hit the point where this library losing function as a library. That's human brain also. Neurons are damaged and eventually we hit point where person can't functioning as a human already. Alzheimer's disease affects around 5 to 7% of world population over the age of 65. And important is that risk of Alzheimer's disease dramatically increases with age. For example, after age of 80, risk is more than 30%. Usually, predominantly it affects women. Now let's say what is mechanism and how this disease is formed. We have two types of damage in the brain during Alzheimer's disease. First is called plaque formation, which is called beta amyloid protein deposition outside neurons. So beta amyloid deposition is important. It is beta amyloid and it disrupts neuronal connection. And another damage of brain during Alzheimer's disease is tangle formation. You can see these tangles. These tangles are twisted proteins which is called tau proteins, and these proteins are deposited into cell, into neurons. So if we have plaque and beta amyloid deposition outside neurons, we also have tau protein deposition or tangle formation inside neurons, and it disrupts cellular functions such as transport function, nutrition, and eventually causes cell death. This is two mechanisms how Alzheimer's disease progressively destroy person's brain. And on this image you can see normal brain and shrinked brain because of Alzheimer's disease. This is huge difference. Now let's say about symptoms. What is early symptoms? Now let's say about symptoms. What is early symptoms and late symptoms? Usually it starts with forgetting important dates, repeating questions, and usually family members noticed it first that person is asking repeatedly same questions, difficulty planning and solving problems, troubling with familiar receipts or bills, confusing with time and place. It's important. And in late stages, severe memory loss and person can't recognize even family members, and loss of physical abilities also common. That's symptoms. So Alzheimer's disease symptoms are so prominent that near person always can notice it, but when it starts it can be very mild. What is risk factors for Alzheimer's disease? Genetic component can have some role, but most important part is aging. Aging is most significant risk factor. Genetic component is important if it's early onset or familiar types. Some types of Alzheimer's disease, early onset Alzheimer's disease, can develop younger ages, for example less than 30 years old, but such cases are very rare. Usually it affects people after 65. It's usually diagnosed after 65. Hypertension, high blood pressure, smoking, obesity, they all can affect risk of Alzheimer's disease also. and we should focus on it. Diagnosis is based on symptoms and clinical picture. No specific tests exist and no need usually, but we can confirm diagnosis for lumbar puncture, but this test is not routinely done. And what is treatment? We have no treatment and we have no cure, but cognitive therapy, physical therapy, health diet can improve patient's condition. Also cholinesterase inhibitors and memantine also used. They can slow down the cognitive decline process, but this effect only observed in some patients, not all patients. Some protective functions can have supplements like vitamin E and omega-3, but these findings are controversial and it's not effective in many cases, but there is some researches that they can have some protective effect. What is prognosis? If disease is diagnosed, usually in 4 to 8 years, person will die. So it affects, this disease affects person lifespan and longevity. Some cases, patient can live up to 20 years, but usually after diagnosis, person lifespan is 4 to 8 years. So Alzheimer's disease is a really dramatic disease because it's very difficult for person and personality is destroyed over time. On the picture you can see first patient with Alzheimer's disease described. Alzheimer's disease was described by Dr. Alzheimer, that's why we call it Alzheimer's disease, and he described this patient first. Thank you for your interest, thank you for your watching. If you like my videos, please thumb up. If you like my channel, please subscribe. Thank you very much. Bye for now.